Now you can also see radio. Equinoxe.
Good afternoon, ladies and gentlemen. Thank you for connecting to Equinoxe Radio Multimedia to get updates on health. Today, we are going to be looking at stroke. Stroke is a leading cause of deaths in Cameroon and in other Western African countries. Approximately 70% of deaths from stroke and 87% of stroke-related disability occur in Africa. On today's edition of the program, we are going to be looking at the prevalence and risk factors associated with stroke in Cameroon. Let's go on a short break. I will be right back. Welcome back. With me here in the studio is a neurologist. He's called Dr. Daniel Gams-Massey. He's a neurologist at the Douala General Hospital. It is a pleasure having you here in the studio.
Thank you, Immaculate. Good afternoon. Good afternoon to all. It's my pleasure to be here.
So, doctor, today we are going to be looking at stroke. What exactly is stroke?
Stroke is the sudden onset of focal neurological sign or deficit related to either an obstruction of a blood vessels in the brain, which is a ischemic stroke, or a burst of a blood vessels in the brain, which is called hemorrhagic stroke. And the stroke is the leading cause of disability in adult, is the second cause of dementia, and is the second cause of death worldwide. All cause included is the second cause of death worldwide, and is one of the major neurological disease and is the main neurological emergency.
You just talked about two major types of stroke. So now, are the manifestations different?
No, classically we have the same manifestation. All sign of brain injury of sudden onset out of a trauma is a stroke.
Okay.
Until you have you prove the contrary. But all sudden sign of brain injury out of trauma is a stroke. That's why you can have a sudden loss of speech, sudden loss of vision, sudden weakness of the face or of the arm or of the leg, or a sudden loss of consciousness. It is considered as a stroke until you prove the contrary.
And what can cause that?
Okay, you have many causes of stroke depending on the type, either ischemic or hemorrhagic. Mm-hmm. Let's first talk about the ischemic stroke. The cause of ischemic stroke can be a cardiac problem, can be also a problem related to blood vessel, especially for those who have high level of bad cholesterol. It can also be due to a problem in blood coagulation, blood clot. The second type, hemorrhagic stroke, the main cause of hemorrhagic stroke is hypertension. But you have other causes like malformation of blood vessels, aneurysm, inflammation of blood vessels, and even procoagulant. That means the drug that decrease the coagulation can also lead to hemorrhagic stroke.
Okay. Now, who is more susceptible to suffer from a stroke?
That is the main important question, because it gives me the opportunity to talk about the risk factors.
Okay.
The risk factor of strokes are divided into two main. The first are the risk factor where we cannot do something, the non-modifiable risk factors, especially the age. Old age is a risk factor of stroke, especially more than 65 years old is a risk factor of stroke. Men are more exposed to stroke than women, especially before 65 years old. And if you have a previous stroke, you are more susceptible to do another stroke, to have another stroke. And if in your family you have a family history of stroke, you have a higher risk of developing stroke. Yes, but you have the most common risk factor, which are modifiable risk factors, and the main one is the hypertension, high blood pressure, diabetes. We usually call it sugar, diabetes, high cholesterol, sedentarity, so that means lack of physical activity, alcohol consumption, tobacco smoking, imbalanced diet with increase in salt, increase in fat, increase in sugar, and even stress. Stress is a risk factor also of stroke.
You talked about hypertension. So now, what's the relationship between hypertension and stroke?
The main relationship between hypertension and stroke is that hypertension will lead to a degradation. It will lead to degradation of blood vessels, especially the wall of blood vessels. So for hemorrhagic stroke, the wall of blood vessel will become fragile. So any increase in blood pressure will burst the blood vessels. For hemorrhagic stroke, due to hypertension, you have a modification of the inner part of the wall of the blood vessel and accumulation of fat. And later on, that fat can either obstruct completely the blood vessels, or a part of that fat will leave that place and go and block a blood vessels far away.
From what you just explained, you said men are at higher risk of developing a stroke. Why this? What makes men different from, like, when we talk about the risk, why is it different from that of a woman?
Yeah, this is true. Men are higher exposed to stroke. This is true before 65 years old. And we think that is because of the protective effect of women hormone or female hormone, which reduce the impact of high blood, of diabetes on the wall of blood vessels. So there is a protective effect of female hormones that decrease their risk to develop a stroke, especially before 65 years old. And after 65 years old, the risk is the same now.
Okay. So now, when we are talking about hypertension and diabetes, in case someone is not suffering from these two diseases, can the person still suffer from a stroke?
Yes, a stroke can affect anybody at any age. We can have stroke even in newborn baby, or you can have stroke also in elder. So hypertension and diabetes are the most common risk factors of stroke. But you have other risk factors. As I mentioned, stress is a risk factor of stroke. Imbalanced diet is a risk factor of stroke, and you have some rare disease like hemophilia, coagulopathy, etc. We have some other risk factors of stroke, but the major one are hypertension, diabetes, tobacco smoking.
And so now, how can I just look at someone and tell that person is suffering from a stroke?
Okay, when you are in a phase of a person that is actually developing suddenly, weakness of the face, loss of speech or slurred speech, weakness of a arm, weakness of the leg, or sudden loss of consciousness, you have to think about stroke first and bring the patient to a hospital or to a health center.
And is there any link between stroke and epilepsy?
Yes, stroke is one of the cause of epilepsy, especially in older people, in adult, because stroke will lead to brain injury, and that brain injury will later on develop epilepsy. So epilepsy is a sequelae of stroke.
I see.
Is a sequelae of stroke.
And you talked about rushing that person to the hospital. Why is it important to rush that person to the hospital? Is it a way of bringing that person back right at the place where you are? Imagine, okay, in rural areas like in the farmer region where we know hospitals are very far, and before arriving there, you know what can happen. So is there not any first aid anyone can carry out before at least thinking about hospital?
Except if that one is a secularist, is a professional secularist, he will not do anything. I've seen some video where you pinch the finger of the patient.
Use a needle.
Is with a needle. It's not true. It will not help the patient. It will not help. It is of no need. So what is important to bring as fast as possible the patient to an hospital is because when you have a stroke, you lost 100,000 of brain cells every second. 100,000 of brain cells every second. So that means if nothing is done rapidly, you will probably lose more than 100 million brain cells due to your stroke. And we know the importance of brain in the life.
What can be done to reduce stroke?
Okay, what can be done to reduce the prevalence of stroke is to fight against modifiable risk factors. To fight against hypertension, and we already know it is just a modification of our habit, especially change the way we are feeding. We have a Western way of life now. We like hamburger, we like soda, a lot of soda, a lot of sweet with cake. So we have to change it. We have to come back to essential feeding with more vegetable, more fruit, less salt, more water. And in addition to that, we have to do physical activity frequently. And if you are already hypertensive or diabetic patient, you need to be monitored closely. You need to be followed up closely. What we observe now in Africa, and what has causes the burden of stroke in Africa, is because many patients with hypertension and diabetes do not follow well their treatment.
Yeah.
And if we just a number, in a study done in Cameroon show that 80% of patients with hypertension are not controlled.
They are unaware about it.
Yes, they are not controlled, and those who are on medication, they are not controlled, and they don't know that they are not controlled. So that is the problem.
Okay, if you're just joining us on the program, then know you're watching, or for those on radio, you're listening to the program You and Your Health, and I have as guest Dr. Daniel Gams Massey, a neurologist at the Douala General Hospital. To participate in the program, you could call us through the following numbers, which will be displayed on your screen by Fem Yemeli, our technician. He will soon be displaying on the screen, which is 655-511111. I repeat, 655-511111 or 652-025050, 652-025050. You can call those contacts in order to get your questions on stroke being answered by a professional. So back to you, Dr. Gams. Now I want us to look at the prevalence rate of stroke in Cameroon. Is it high? Is it low?
Yeah, we think that it is high. There is no actually population-based study done, but based on based on data, hospital data, we know that, for example, stroke is the main cause of hospitalization in neurology, but also in internal medicine. That means all specialty that treat non-surgical disease in adult, and it represents 1 patient out of 3 hospitalization in the internal medicine department of Douala General Hospital, for example. And there is an increase in the prevalence of hospital prevalence of stroke of about 12% from 2009 to 2013. So the number is still increasing. So we have more and more stroke. There is no day I can say that there is no day where the emergency does not call me for a stroke patient. Every day we have a stroke case in Douala General Hospital.
We have a call on the line. Hello, good afternoon.
Good afternoon, madam.
Yes, your name, where you're calling from, and your question.
I'm called Nadesh,
Nadesh?
and I'm calling from Yaoundé.
Okay, Nadesh, thank you so much for participating. Your question then.
I would like to ask the doctor
Yeah?
about what value is a pregnant woman known to be hypertensive, because most of the times we see in hospitals, women come with issues of eclampsia or preeclampsia, and they are known to be hypertensive. So I would really like to know a pregnant woman at about what value is she known to be hypertensive.
Okay, thank you so much for participating, Nadesh.
Thank you for the question. We know that hypertension is the main risk factor of stroke, and in pregnancy, the hypertension, the diagnosis of hypertension, and the range of blood pressure that give us the diagnosis of hypertension is the same as for any other patient. When we have different stage in hypertension, and we know that when the blood pressure, the systolic blood pressure, is more than 130, okay, we are at the level of stage 1 hypertension. So when the systolic blood pressure is more than 130, you have to be very careful, because the blood pressure at that time is not normal. And when the diastolic blood pressure is more than 90, at that time the diastolic blood pressure is not normal. So it's the same range, more than 130 on 90 millimeter of mercury.
So that definitely means there's no difference when you're pregnant and when you're not pregnant.
There is no difference. There are some specificities,
okay,
especially when you consider the baseline blood pressure. But
we have another
classically, there is no difference.
Okay. We have another caller. Hello?
Hello, good afternoon.
Good afternoon, madam. Your name, where you're calling from, and your question.
Yeah, this is Amina. I'm calling from Yaoundé.
Okay, Amina. Your question.
Yeah, I'm listening to the program with Immaculate and the neurologist.
Okay.
Yeah, and I have a question for the doctor.
Yeah.
Yeah.
Go ahead, we are getting you.
Yeah, I wish to know how somebody who is having nerve problem, how is nerves related to stroke?
Okay. Is that all? You have another question?
Yeah, that's all.
Okay. Thank you so much for participating, Amina, all the way from Yaoundé. We'll be answering that question in a few minutes or a few seconds.
Okay, thank you for this question. Make us come back to the sign of stroke. As I mentioned, stroke is a sudden onset of sign related to brain injury that can be a weakness of the face, slurred speech, loss of consciousness, weakness of the arm, or weakness of the leg. So these are classical signs of stroke. So to think about stroke, you have two things: sudden onset of symptoms and symptoms related to brain injury.
Okay. So now, you said a stroke can reoccur as many times as possible. So why is it that after being taken to the hospital, there's still a risk for you to get another stroke?
Yeah, I have a small story of a patient I received last week.
Mm-hmm.
She had 2 ischemic stroke, and in October she had 1 hemorrhagic stroke. So it was the 3rd time she had a stroke. So when I take their history, what was important to note is that after some time of treatment, she stopped the treatment because she was feeling better. So generally, when a patient has a stroke, the treatment is for the life, and people should take it into consideration, because one of the main cause of recurrence is not follow the treatment properly.
So does that mean there's no cure for stroke?
Yeah, we cannot say there is no cure for stroke, because when a patient do a stroke in the acute phase, that means we have a patient now, especially if it is an ischemic stroke, there is a possibility, for example, to remove the blood clot or to dissolve the blood clot. It is called thrombolysis, to dissolve the blood clot, and thrombectomy, to send an apparatus and remove the blood clot. But it is not really done in Cameroon. It is done in Western country and some other country, but in Cameroon is not yet done. So we need to manage that acute phase, and that end.
We're coming back to that, please.
Yes.
We have a call on the line.
Okay.
We just lost that caller.
Okay. So we need to manage properly the acute phase to prevent the death, to prevent the sequelae also.
Can a child of about 5 years suffer from a stroke?
Yes.
And the symptoms, are they just the same way as that of an adult?
Yes, the symptoms can be the same. But the problem with a child is that the brain is still growing up. So some signs can be the same, but you can have some specificities.
Come back to that question. Hello, we have a call on the line. Hello? We have another caller. Hello?
Good afternoon.
Good afternoon, sir.
Hello, good afternoon.
Good afternoon, sir. Please, can
Good afternoon.
you turn off your TV set or your radio set whenever you're calling? Hello?
Hello?
Yes, sir.
Hello?
Hello, sir. Good afternoon.
Yeah, good afternoon.
Okay, what's your name, where you're calling from, and your question?
Yes, I want to participate in that program.
Okay.
Is it possible?
Yes, feel free. Go ahead.
Okay, I am Kubi Fidelis from Douala. Yes, I was diagnosed of high hypertension, which ranges from above 150 on 105. Yes, and then I started treatment for 2 months.
Yeah.
And at the same time, they asked me to go into some natural products like bitter leaf, mixed with ginger, and so forth. Meanwhile, before then, I had also a problem with nervous problem. Now I'm taking treatment for nerves. Now I don't know whether the treatment for nerves and hypertension, whether they can help me, or whether the other advices to take green vegetation or bitter leaf. I don't know. At times I'm confused.
Okay.
At times I see my hands. My hands are like I want to have like I don't know whether it's true or whatever. My hands are the other type. At times I experience my feet like swelling. I don't know whether it's still the symptoms or something else.
Okay. Dr. Gams will be answering that question for you.
Okay, thank you. What is important when you are diagnosed of hypertension or high blood pressure is to follow up your treatment and follow the recommendation of your physician. Adding any other treatment to your treatment, it is a risk, not only for your disease, blood pressure, but it can lead to some complications. So before taking any other treatment, make sure that you get the advice of your physician. So now about the symptoms you mentioned, as I said before, when it is sudden, we think of stroke, but you can have a brain injury of any other cause or a nerve problem of any other cause than stroke. That's why it's important to consult to have a proper diagnosis.
Okay, so now you are working at the Douala General Hospital. How much does it cost to treat a patient suffering with a stroke?
That is very important because we did a study in the hospital and also in Lakentini Hospital. The study showed that just for hospitalization, just for hospital care, a patient with stroke will spend about 800,000 to 1 million CFA franc. Only in hospitalization. We are not talking about the post-stroke treatment like physiotherapy, continuously medication, etc., etc. So the best way to fight against stroke remain the prevention, because as somebody said, stroke is free, but the treatment is expensive.
But couple the fact that we know more than half of the population of Cameroon are low-income earners. How do you think a low-income earner will be able to spend close to 500,000 francs just for hospitalization, and without talking about treatment in this?
Yeah. So it's difficult. We know that we are a low income country, and most people cannot afford
for sure
to be treated at this price, at this cost. It is high. Even for me, it is high. But there is, what we are doing now is to train physician, especially first line physician like general practitioner, to have the ability to diagnose and manage acute stroke in their environment. It's not easy, but it's the only way for us to reduce the burden of stroke in our setting. So that's why actually we are organizing a scientific day during the open door activity of the Department of Medicine and Specialty in Douala General Hospital. The aim of this scientific day is to train physicians, especially young physician, general practitioner, to have the ability to manage stroke in their area, in their community.
Okay, so what last advice do you have for persons who are suffering from stroke at this moment, and maybe hope is lost, maybe they think all is gone, but how can you bring them back to that state where they can say all is not lost?
Yeah, all is not lost because the brain has the ability to do what we call neuronal plasticity. Is one of the major quality of the brain, is the ability to adapt itself. When everything is lost, the brain has this ability to adapt itself and promote the recovery. I've saw many patients with complete paralysis that recover. I've saw many patients that recover from loss of consciousness, from speech disorder. So it is possible to recover. It is possible to avoid another stroke. It is possible to prevent stroke because 80%, more than 80% of stroke are preventable only by fighting the modifiable risk factors, hypertension and diabetes.
Before we end this program, you talked about diet, which plays a very important role in order to avoid stroke. What are some of the food people need to consume in order to avoid a possible stroke?
Okay, the classical recommendation is to eat more vegetable, eat more fruit, reduce red meat like cow meat, for example. Okay. You can eat fish, you can eat a bit of chicken, reduce fat intake and reduce salt intake also.
Okay. Thank you so much. I would equally like to thank Nadesh from Yaoundé, Amina, who is equally in Yaoundé, and Fidelis, who is in Douala, for calling and participating in the program. I hope all your issues or questions you had, or those questions you asked, were well answered for you. And that's it for this edition of the program. You and Your Health. I had as guest Dr. Daniel Gams Marcy, a neurologist at the Douala General Hospital. And for technical expertise, that was done by Ephraim Yemeli. For presentation, I am Immaculate Fogwe. Stay tuned in the company of more programs on Equinoxe Radio and television. So long.